because I went over the cadaver ones last time, we'll go over the model ones and look at the ones we might want to see, right? So what do we have over here? We have, starting from this side, over here, we have the temporalis muscle. Temporalis muscle, this is one of your chewing muscle. What is the act? Where is the origin? Temporalis, what is the insertion? It inserts onto the coronoid process of the jaw, right? The temporalis. And then you have the masseter, the other chewing muscle. Over here, the masseter muscle, which from the zygomatic arch of down onto the mandibular angle. And then for, these are your chewing muscles. And for like facial expression muscles, you have that orbiculus oculi versus your orbiculus. I know I'm spelling these wrong. I don't take off for spelling, by the way, so you don't think I'm hypocritical here. Orbiculus oris, right? These round ones that go along here. What is there? I'm not sure. Opening, pursing your lips, or whatever is the action. Whatever you are, remember where you're learning. What you have to know is that muscle origin insertion action sheet. So those are those two circular muscles, and then the rest, the two facial muscles shown here are your zygomatic major, right? That's going in an upward direction versus your risorius. Risorius, something like that. Risorius muscle that pulls it like kind of straight back, right? This is your smile muscle. This is your fake smile muscle. And this is your frowny face, right? With your depressor. Here, right, slower here. Anguli oris, right? Oris. Right, bringing your muscle down. And so those are some of these over here. And then those are your facial muscles. And then we have this muscle going from your mastoid. Well, actually, it's originating on your sternum and your clavicle area, right? The origin. Well, here it inserts up on your mastoid. So that's your sternocleidomastoid muscle. What is its action, right? It contracts, it's going to pull down the neck, right? Flex the neck. So I don't want to write all these over again. I'll just mention, because that's the temporalis, right? Your orbiculus oculi over here, right? There's a bunch of muscles you don't have to know, already labeled, but then your two muscles over here, the superior one, right? That's a little bit closer to the nose, is your zygomatic minor, right? Where the lower one over here is your zygomatic major. Okay, the major is lower. It's the bigger one that's a little bit lower. Right, and this is showing your masseter over here, going from over here down over here. Here's that muscle going straight back. That's the risorius. And here's your sternocleidomastoid going down over here, right? And then this underneath here is actually, this is a tricky one. This is your buccinator. And for the first 3 semesters I taught, I called it the buccinator. So that's the buccinator right there. That's kind of compressing your cheeks right over there. So that's deep to the risorius actually, right? And then we have your orbiculus oculi up here. Same stuff, your orbiculus oculi. So, I mean, this one looks a little different. I probably wouldn't you ask this if this is the minor, because that doesn't really match up with most of the other ones that you have to know, the zygomatic minor. But the big one over here is the zygomatic major, right? Masseter muscle. This is the risorius going down over here. And this is the buccinator that's kind of going kind of in parallel underneath the risorius. Depressor, right? Depressor, anguli oris, making you frown. Sternocleidomastoid. And your zygomatic major again. More of these just from different views. Your zygomatic major is the big one, and then risorius, depressor, anguli oris. And then these are just for fun, right? Your zygomatic major, minor, orbiculus ori, smile muscles, your frowny muscles. I actually I don't ask this one here, but it's your occipital frontalis, but that's not on your list. So over here again, those same muscles. Masseter, temporalis, masseter. And these eyeball muscles, just remember, this will be, when we get to the cranial nerves and the other section, we'll see the nerves that do this. But on the top of the eyeball, right, is your superior rectus muscle. And then on the side right here, this would be like, this would be the nose side over here. So this is the lateral side. This is your lateral rectus muscle, right? So to pull your eye toward your laterally, right, this would pull your eyeball up. And then you have this superior oblique muscle, right, going around this little trochlea over here to attach over here to kind of turn your eye up to the sideways there. Right? This is just a different view, superior, lateral, and oblique, superior oblique muscle. Sternocleidomastoid. And now we're getting down to the trunk area. So remember on these models, we have a superficial muscle side, and on the other side, they often like remove some of the superficial muscles, see the deeper muscles. We don't get too deep, mind you, right? Just those first ones, if you remove, in this case, they remove the pectoralis major over here and the external obliques. That's going to reveal your rectus abdominis over here, your internal obliques, and you can't see the transverse abdominis, which would be going under here. All right, so your external obliques is external, and on the other side here, these a little deeper muscles is your internal obliques. Notice the way I have my arrows over here, like they're kind of pointing down. Your external obliques make kind of a V shape arrangement, whereas your internal obliques kind of make an A shape as far as the direction of the fascicles. And then the other muscle you'll see as you remove the pectoralis major is your pectoralis minor coming off the intercostals right here. And then for each of these, just for a lot of your muscles, if you have compressed abdominal, that's good enough. If you want to remember one thing for all these, right, rather than like remembering vertebral flexion or something like that, if you remember compressed abdominal, right, because these are all creating that internal pressure holding in your guts. So that's a good action to remember. You only have to remember one thing, not everything. And then your delts, right, your deltoid muscle coming off this area. I just asked for the insertion over here, which is your deltoid tuberosity. And then this is the front of your arm. So this is your biceps brachii, not distinguishing between the long head and short head in this case. And over here, same thing, except on this side is the superficial side again. Deltoid muscle over here, pectoralis major, right? And then you have, again, because it's the external side, the external obliques, right? Remember making that V frame, whereas it's like the muscles going that way, whereas your internal obliques are kind of going that up direction, right? And then your rectus abdominis, and then your pec minor, which is deep to the pec major, right? Coming off the rib cage. And what else do we got here? Oh, so in this one, you can't really see it, but I'm telling you that these are the external intercostals, which means the ones just deep to it are your internal intercostals. Right? They're just sitting there deep to it. And this is a cross section of the body. You have your diaphragm, basically, right? It's originating all over the rib cage, right? In the front, in the sternum, and then it inserts onto itself on the central tendon right here. And you got these hole in the middle where your large blood vessels and esophagus and stuff go through. All right, and then this is the other sort of deep view over here, right? All the guts are removed over here. So you could see the right in the back coming off your iliac crest over here, inserting onto your vertebrae is your quadratus lumborum, right, into your lumbar vertebrae. Right? And those are on either side, or left and right, quadratus lumborum. That's the only picture we could see that in, except for maybe one of the cadavers. And then these two muscles, deep, your deep core muscles here, your iliacus, iliacus, iliacal, and your psoas major, which both insert onto the lesser trochanter. So that's why they're often called the iliopsoas muscle. They're coming from the same place, right? This one just starts over here, and psoas major inserts into there. What is their action? Right? They're both hip flexors because they're going on the front. They're covering on the front of the hip joint over there. Psoas major is a major hip one. If you've ever done yoga, I'm sure you've heard of the psoas major. All right. And then looking over here, right, we got the two sides of the neck, right? Your sternocleidomastoid on one side, your trapezius, your upper traps on the other side. Flexion of the neck, extension of the neck, right? Bringing it forward, bringing it back, and hyperextending on the back there, your upper traps. Your pectoralis major, right? I think you could just write flex shoulder is good enough for this one. And then over here, you see these muscles over here are your serratus anterior. And that'll be inserting onto the medial border of your scapula on the anterior side right there. So these are these muscles, these little knife-shaped things right here, but then these over here are your external obliques, right? These over here are your serratus anterior. Then again, pec major. All right, now we're looking at the back of the model over here. Again, superficial on this side. Over here is left side over here. And then this is the deeper muscles just underneath them. So in this case, you have the trapezius, right, going along the stack that's been removed on this side. This is your middle traps. Here's your lower traps, right? You can tell by the orientation. And then just deep to that in some regions is your latissimus dorsi, right? That's coming from this broad region and inserts around the intertubicular sulcus of the humerus, right? So does this. This has the same insertion point. This is your teres major over here. So it's called the lat's little helper sometimes. It's a synergist to that, and it inserts onto the same place. Notice the direction of this fascicles compared to these. That's your teres major. This one that I'm pointing out here is your infraspinatus muscle. Infraspinatus muscle. Okay, and you can see that is this one over here. It's only partially covered by the trapezius, but you can see it right here. And so there's the teres major, teres minor. I didn't label it here. That, right? And then the one deep to the trapezius, when you remove it, are the rhomboids, right? Coming from your vertebrae, inserting onto the scapula over here. And since we're looking at the back, remember your landmark tendon over here where your triceps insert to, right? Your elbow. So here's your triceps. So I tried to put these arrows in the direction of the fascicles there, thinking it would help, but nobody get it. All right, here we are, same picture again, same stuff, except for, let's see, I have this one labeled. I'm not sure this is on your list at all. It might be, but that is your attached on your scapula. It elevates it, so that's the levator scapula, right over here. And then here's the deltoid muscle over here, and your trapezius is removed, right? So these are all your rotator cuff muscles, right? Your supraspinatus, your infraspinatus, your teres minor, and your teres major, which is not, remember, a part of your rotator cuff muscles, but that would be that, right? Remember the rotator cuff muscle sits, right? Supraspinatus, infraspinatus, teres minor, and then your subscapularis on the front. Right, these muscles. This is the only picture I have, I think, with your erector spinae muscles on it. Going down, they're going to be running sort of lengthwise down your back. I might have one more. Maybe I took a picture from something else. And then the other deep muscles over here are your rhomboids. Here I have two ones, your rhomboid minor and your major, but just rhomboids will be good enough. Don't worry about those. Right, so here's your trapezius. The minor one is above the major. Zygomatic minor is above the zygomatic major, but I wouldn't worry too much about that because I don't even break these down. It's just the rhomboids. And your trapezius, in this case, I'm not pointing at anything in particular. Deltoids, over here, your latissimus dorsi, big one going over here. And here we got your triceps. Again, I don't ask to distinguish between the long and lateral head or anything like that. Just your triceps. Moving down, right, you got your gluteus maximus that inserts onto that big tendon going down the lateral side of your leg, your IT band, right? That's your biggest muscle on the back right here. Just deep to that and kind of lateral is that medial gluteus medius. So it's kind of weird. It's on the lateral side. It's called the gluteus medius, but that's just because it's smaller and a little bigger than the gluteus minus, but you don't have to know that one, right? Gluteus maximus, gluteus medius. See the direction in fascicle. Okay, this is a nice one for your serratus anterior, right? These boxer muscles that you can see on like MMA fighters and stuff like that. They bulge out because this basically prevents, if you're punching somebody, it's preventing you from the arm going back and allows you to drive your fist into somebody's head. All right, so that's your serratus anterior. And then the ones underneath it are going to be your external obliques, right? Pec major. Right, so external obliques, serratus anterior, and then your pec major. And here's another slightly weird one. And this is with your external muscles on the trunk removed. So that's your pec minor over here. And these would be your serratus anterior muscles right over here. And those I'm not asking you about. And these on the trunk here, since they're going up over this way, over here, these would be the internal obliques, right? Because they're internal to them. All right, that's it for the head and trunk area. Next time we'll be going over the limbs, starting with that.